Ankle injuries are among the most common reasons people visit urgent care. Ankle x-ray is required if there is pain in the malleolar zone and any of the following. A few years ago, I sprained my ankle during a hike, and I thought rest would be enough, but the pain lingered. Any well-made brace can do the job, but if you'd like my recommendation, these red flags could mean there's something more serious going on. And if that's the case, here's what we actually do in urgent care. Welcome to Urgent Care Uncovered. I'm Dr. Yomi Adeyemi, a board-certified urgent care physician, but you can call me Doctor Dynamo. Every week, we delve into common conditions that bring people into urgent care and provide the real facts you need to stay healthy. Have you ever twisted your ankle during a jog or felt sudden pain while walking? Ankle pain is more common than you might think. And today, we're uncovering the real reasons it happens, who's most at risk, and when it's time to seek medical attention. Hey guys, really quick before we jump into the video, I just want to say that, believe it or not, more than 90% of you guys watching this video right now aren't subscribed. I want to continue bringing you guys high quality content here on the channel. And to do that, we need your support. I'm not sponsored by any big industry names, and everything we do here on this channel is supported by you guys. So if you subscribe now, my commitment to you is that me and my team will continue doing everything in our power to bring you guys the highest quality content. Thanks for listening. Let's get into it. This is Jordan. During a weekend basketball game, he landed awkwardly after a rebound. He felt immediate pain and swelling in his ankle. Thinking it was just a minor sprain, he tried to walk it off, but the pain persisted, and he found it difficult to bear weight. Ankle injuries are among the most common reasons people visit urgent care, but not all ankle pain is created equal. Understanding the type and severity of the injury is crucial for proper treatment. When assessing ankle pain, we look for signs like swelling, bruising, and the ability to bear weight. One of the tools we use is something called the Ottawa ankle rules, a set of guidelines to determine if an x-ray is necessary. Ankle x-ray is required if there is pain in the malleolar zone and any of the following: bone tenderness at the posterior edge or tip of the lateral malleolus, bone tenderness at the posterior edge or tip of the medial malleolus, inability to bear weight both immediately and in the clinic for 4 steps. These rules help us avoid unnecessary imaging and focus on cases that truly need it. Let me share something personal. A few years ago, I sprained my ankle during a hike, and I thought rest would be enough, but the pain lingered. It wasn't until I followed a structured treatment program that my condition improved. Now, treatment for ankle injuries often includes rest, avoiding activities that cause pain, icing, applying 15 to 20 minutes of ice every 2 to 3 hours, compression with an elastic bandage to reduce swelling, and elevation to keep the ankle raised above heart level. And over-the-counter pain relievers like ibuprofen can definitely help reduce inflammation and ease discomfort. But let me tell you something important from my own experience. Even after my ankle healed, for months afterward, if I stepped the wrong way, I'd feel that sharp, familiar pain again. Even though you're healing, the ligaments and muscles remain weaker and less stable. That's why wearing a high-quality ankle brace is so essential. It stabilizes your ankle, supports recovery, and helps prevent future injuries. Now, any well-made brace can do the job, but if you'd like my recommendation, I've included a link in the description to an ankle brace that I trust. Now, this is an affiliate link, and that means if you purchase through it, you're directly helping to support our channel at no extra cost to you. Every penny helps us to continue providing reliable advice here on the YouTube channel. Now, while many ankle injuries can be managed at home, there are definitely moments when you should stop everything and get checked out right away. Severe pain or swelling, especially right after an injury, is important to take note of. Inability to weight bear on the foot, visible deformity or misalignment of the ankle, an open wound over the joint, or any signs of infection, which would be redness, warmth, swelling, pus, plus, or a fever over 100 degrees Fahrenheit. These red flags could mean there's something more serious going on, like a fracture, a torn tendon, or even an infection in the joint. And if that's the case, here's what we actually do in urgent care. If we suspect a fracture, the first step is to get x-rays. If the break is clean and doesn't require surgery, we'll typically stabilize the joint with something like a cam boot or walking boot, or a splint or cast, and refer you to an orthopedic specialist for follow-up. On the other hand, if there's concern for a serious ligament tear, like a syndesmotic injury or an Achilles rupture, you may need an MRI and immediate referral to sports medicine or ortho. And if there are signs of infection, we don't wait. We start you on antibiotics right away, sometimes oral, sometimes IV, depending on how serious it looks. And in many cases, we'll draw blood or even send you to the ER if the infection might spread. So, yes, a lot of ankle injuries are minor, but when they're not, we've got a plan. And the sooner you get checked, the sooner we can keep something small from becoming a potentially lifelong problem. Now, ankle pain is a common complaint, but understanding its causes and knowing when to seek help can make all the difference. That's what Urgent Care Uncovered is all about, empowering you with the knowledge to take control of your health. Thanks for tuning in. Stay informed, stay proactive, and as always, stay dynamic. I've been Dr. Yomi Adeyemi, and I'll see you in the next episode of Urgent Care Uncovered. Peace.